Good morning, everyone. Welcome to the bucket courses. I'm Joanne Bundy, and while I am encouraging you to silence your cell phones and turn on your tea coil, I'll give you a couple of brief announcements. The first is that the little half sheets of blue paper on your chairs today are for your suggestions and comments concerning not only this bucket course, but anything about the bucket courses that you would like to make known to the planning committee. It is not required, of course, but it's your opportunity to put in your 2 cents worth. And just fill it out if you like, and then leave it on the table in the hallway. A week from today will be an open Wednesday, and volunteers from the Grinnell Historical Museum will be doing a program. Excuse me. And since it's open Wednesday, there is no tuition and no registration. Just come. And I advise you to come early because we are limited to 90 for our fire code. And 2 weeks from today will be Professor of Biology at Grinnell College, Clark Lindgren, who will be talking about the criminal brain. And Jim Arns will be sending out an email for your registration on that. So I'll hurry right along and give the program over to Dr. J.R. Paulson and the last class of his 4-class course on Good Grief, Charlie Brown.
Thank you, Joanne. How's the sound test in the back row? Thumbs up? Great. Okay, get that, folks. I'm pointing right at my sensor. Oh, we gotta get out that off, right? Let me close this out. There we go. Now maybe it'll work. Part 4, putting it all together. So today I'd like to cover basic information and points on grieving. So this is the money lecture. Specific suggestions for navigating through mourning. One of very, very specifics. When grieving goes awry. Work to do for completing uncompleted emotional relationships, and we'll have to talk about that. Anticipatory grief. I went over all your questions that you had at the first of the class, and I have about 95% of them answered by the end of today. However, I went through some grieving this morning, or yesterday morning at 4:30 when I realized I had to do this, adapting, rebuilding our belief system, stage 4, which you don't even know what that is, and finding meaning in loss and using what we've learned to live well today. That's the whole theme for another lecture or two. There's no way that would be crammed into today. I thought I would try to do it, but we're not going to. Today, the first thing that I thought, remember we gave our pyramid on how I treat both in sex therapy, but also I think it works the model for grieving. So today, the first part would be basic information and validation. So the basic tenets are, we'll review these, loss is universal. Grief is a process that one must go through and not around. Grief cannot and should not be hastened. The griever must get in touch with his or her feelings and express them. Grief is completely unique and individual for each person and each loss. It's over when it's over. But some losses, we are never over. Grief does not follow a linear course. Don't grieve alone. We must tell the story. Again and again and again. Rituals can be helpful in any kind of grief. Commemorate and memorialize the loss. So those are some key theme points that I'd like to go through. I like this as a definition. Grief is internal, mourning is external. I never see your grief. I can see your rituals and your mourning. I think that's poignant distinction in the phrase. Grief is what we feel in here. So we could be grieving and somebody may not show it. That's the point I'm making. People can be in pain and they don't have to be writhing around or look like they're in pain. You can sometimes hide them. How many of you are familiar with the Buddhist story of Kisagami? Raise your hand. Nobody knows about Kisagami. Okay? This is a famous Buddhist story of a young woman who is married, and lives at the time of the Buddha, and she has a baby, and the baby becomes a toddler, and the baby gets sick one day and dies. And Kisagami is just devastated. This is her only child, the center of her universe. She goes around, all around the town, carrying her dead baby in her arms, going to everyone, give me something to bring my baby back to life. She goes to all the people, and they say, well, there's nothing we can do. Go to the elders, go to the medicine people, go to the priest, and they go to them, and everybody says, we can't bring your baby back to life. One elder says, go to the Buddha. The Buddha has the medicine that you need. She's looking for medicine to bring the child back to life. So she goes to the Buddha and tells the Buddha, with her dead baby in her arms, she's carried all over the village, I need medicine to bring my baby alive. The Buddha says, I have that medicine, but you need to go and get a mustard seed, a white mustard seed, and bring it back to me. But it must be from a home where no one has had a death. So Kosagami goes out and goes into the first house and said, do you have a mustard seed? Yes, we have a mustard seed. Yeah, but has anyone died here? Yes, my uncle died 2 months ago. Goes to the next house, carrying her dead baby all the time. Next house, do you have a mustard seed? Yes. Has anyone died here? Yes, my grandfather died. Well, you know the rest of how this is going to go out. Every house she goes to, someone has died. Pretty soon, after many houses, she realizes enlightenment that there isn't a house. Everyone has a loss. Life and death are universal. She takes her son, takes him into the graveyard, and buries him, and then goes back to the Buddha and said, I understand your medicine. And became a follower of the Buddha. So that's the story of Kosagami. And I think there's a lesson to be in all these fables. We shouldn't rush ourselves or others through grief. Remember how long most people think it takes. Remember our study? 48 hours to 2 weeks in the surveys. Recall how others want us to get over it quickly. Why do I want you to get over it quickly? Because when I see you, it makes me uncomfortable to see you suffer. So get over it so I don't have to deal with it. Things to do today. Get up, survive, go back to bed. Sometimes grief, that's your daily list or chore. The experience is a brutal teacher. What you learn from it, by God, you learn. Pain is part of the happiness. That's the deal. C.S. Lewis. We think we want to avoid grief, but in reality, it's the pain of the loss that we want to avoid. Star point. Grief is the healing process that ultimately brings us comfort in our pain if we allow it to happen, without the interference of our distorted thinking. So our brains, things we've been taught, screws it up. We're just allowed to be okay. We can slowly get through this. Remember what Queen Elizabeth II, grief is the price we pay for love. Grief never ends but changes. It's a passage, not a place to stay. Grief is not a sign of weakness, nor a lack of faith. Just, again, the price of love. Grief, a universal experience. To spare oneself from grief at all costs can be achieved only at the price of total detachment, which excludes the ability to experience happiness. Eric Fromm, I think in his book on love. I'll be okay. just not today. Many people, this is the correct response. After all this time, I still miss you every day. It's been said that time heals all wounds. I do not agree. The wounds remain. In time, the mind protecting its sanity, covers them with scar tissue. Again, remember the wound issue and analogy I made? Covers them with scar tissue. And the pain lessens, but it's never gone. Rose Kennedy. Rose Kennedy, if we had her do her loss graph, which we'll talk about later, I think you'd be very impressed. Imagine putting yourself in her shoes. Her first, her firstborn dies in a naval accident in 44. Her second son, John, our president, is assassinated. Her third child is born with cognitive disabilities and underwent a lobotomy in 1941. They carved out part of the front part of her brain and lived to be until 205. So that's your third child. Fourth child, girl, dies in an airplane crash over France. She has another couple of children, and then of course then Bobby is assassinated. So what is her loss like? If she had lived, of course, she would have seen Ed die of his brain tumor, but she died before that, fortunately. So imagine the loss she had. Now, in addition, she suffered the ongoing emotional losses of a philandering husband. All during this time, her husband is out having affairs. So you're trying to deal with all this. It's a good Catholic woman, but isn't this unbelievable? The person who did her autobiography, they found a lot of medicine scripts in her home. Valium, Librium, Quaaludes, all sleeping pills and medication. So you see that she was trying to medicate to get through this grief loss that she has. So she knows what she's talking about when she did that quote. Winnie the Pooh, a little lighter. How lucky I am to have something that makes saying goodbye so hard. Although grief is universal, remember that each grief is individual. Although grief is universal, remember that each grief is individual. Lesson: don't judge, rate, or compare others' losses. Remember this cartoon? The next person who minimizes my grief is getting a swift kick in the shin. I did some research on this lady. I wanted to find out what she was bummed out about. She's really a closet Packer fan. But she's not wearing green, and that's what threw us off. Next point, don't grieve alone. All you Packer fans can hang together again. My experiences as a sister, daughter, and mother have taught me that dealing with grief is not meant to be an individual process. Words of wisdom. So, how do we help others? One of the worst things to say. At least she lived a long life. Many people die young. She's in a better place. She brought this on herself. She's home. There's a reason for everything. Aren't you over him yet? He's been dead for a while now. You can have another child still. She was such a good person, God wanted her to be with him. You think your loss is bad. My loved one was even younger than yours. She did what she came here to do, and it was just her time to go. Everyone has to die someday. Well, at least you're still living. I know how you feel. Be strong. I'll give you some examples of that later. Miscarriage. At least it's not a real loss. What are the best things to say? I'm so sorry for your loss. I wish I had the right words. just know I care. I don't know how you feel, but I'm here if I can help in any way. You and your loved ones will be in my thoughts and prayers. My favorite memory of your loved one is this. Can you tell us what? I'm always just a phone call away. Give a hug instead of saying anything. We all need help at times like this. I'm here for you. I'm usually up early or late. And just the last one, saying nothing, just be with the person. So these are some things to do. One line to remember. What do I tell hospice volunteers? I get this question from you and others. I want to see a patient who's dying in hospice and I'm afraid. I don't know what to say. I want to go in and I want to be with them. What do I say? I could give them that list of litany. But I have one that I like to give this one. Hello, John. I really don't know what to say or do. I just want to be here to help and support you. Please tell me what you would like me to do for you. So that's my one line. When everything falls off, I go back to that one. I don't know what to say or do. Can you tell me? What would you like? Back rub, turn up the TV. Just be here. Read to me Bible verses. So ask. The Charlie Brown cartoon. Just being there for someone can sometimes bring hope when all seems hopeless. In summary, if you want to be a help to others, demonstrate traits of a good helper. What are the traits of a good helper? What are traits of a bad helper? Worst ones, they want to fix it. They're about their own discomfort. They rationalize, they don't validate. They try to explain the loss with some intellectual arguments. It's not about the griever. They want to minimize the loss. Oh, it's not so bad. Oh, you'll be okay. The good ones support you as you are, but don't try to fix. They're not active. They're admitting they can't make it better. We can't make it better. Not asking for something or someone to change their feelings. To even be what they are. Recognize loss. And it's not time limited. Second point, be a good listener. It's extremely important for healing to take place for the griever to tell the story again and again and again. That is very, very therapeutic. And the more you can listen to it, even if you've heard it or other people saying that story is about them, about their life and memories, is just key. All sorrows can be born if you put them in a story or tell a story about them, said the writer Isaac Denison. When loss is a story, there's no right or wrong way to grieve. There's no pressure to move on. There's no shame and intensity or duration. Sadness, regret, confusion, learning, and all the experiences of grief become part of the narrative of love for the one who died. Putting it in the story, written or oral. I'd be remiss if I didn't spend quite a bit of time talking about children in grief, because I think this is very, very important. And I want to give you some specific things about children. We usually do a very poor job of helping our children grieve, but why should we be surprised? We do such a poor job with grief and mourning ourselves. Didn't we learn how to grieve as children? Remember some of my early examples? The boy with the losses, how he was taught to deal with those. What did your parents say to you after a major loss? Think back. Children are the forgotten grievers. So are siblings. Children's grief makes us too uncomfortable. Correct? So we give more comfort to the parents. Oh, your mother, because dad died. Mother, kids, we don't know how to deal with them. So we focus our attention on mom. Children grieve differently. Depends on the age as to how they can process a loss like death. So there is no one magic, well, do this or not do this with the child, because it depends on what their concept is. So you have a young child like this, his thought and his concept of death is very different. Kids age 2 to 4, death is reversible. Peekaboo, hide, no seek, I'm there. Somebody goes, they're back. They don't get this idea it's gone forever. They can be quick and responsive. They don't maybe emotionally notice anything. They live in the moment. They ask, are we there yet? When are they coming back? And you tell them, your grandfather's not coming back. When's he coming back? Ages 4 to 7, the concept of death now is still seen as possibly reversible. Here, these kids sometimes feel responsible or fault. I wish Johnny died because she was so bad to me. Then Johnny dies, then this kid thinks the magical thinking, which kids have, that, oh, my thinking maybe had something to do with Johnny's death. And they have that and internalize it. Sometimes they have questions, why did this happen? They tend to have more emotions over the loss. Children aged 7 to 11, their concept of death now, understanding death, it's final. They're not coming back. It could be a punishment or a consequence. Is God punishing me? Why is this happening? They're looking for answers. They have sometimes pretty tough little questions. And we're going to have to talk about how do we answer those and how should we answer those. Beginning of a mourning process. Teenagers, difficult age anyways, but let alone with loss. Their concept of death, they get it. They're not coming back. Sadness, anger, pain, aggression, they don't want to share with the family. That's normal for kids at this age. Dangerous activities and drugs are a problem. What are the danger signs if you have a teenager that's grieving? Well, one can expect certain levels of rebellion, moodiness, impulsiveness, reliance, or egocentrism. There's some signs that parents and grief counselors need to be aware of. Red flag behaviors include suicidal thoughts, chronic depression. They isolate from their family and friends. They don't go out and hang out with their buddies anymore. Academic failures, change in personality, eating disorders, particularly for girls. They get into drugs, fighting, inappropriate sexual behaviors. Girls sometimes become promiscuous this time. If these symptoms or behaviors manifest, the teen may be experiencing a complicated grief reaction, which we're going to talk about more later. Important points about children and grief. I ask, well, when can this little kid grieve? When are they old enough to grieve? If you're old enough to love, you're old enough to grieve. The biggest mistake parents make is telling their children nothing when it comes to death. That's the big mistake parents make. If not told, children will create and imagine explanations, often worse than the real reality. Adults don't mention or discuss death or dying for fear of upsetting their children. They don't want to talk about it because it will upset them. Children will fill in the blanks, however, themselves, if a partial answer is given or statements are given. And children often take words literally. Let's take a look at this. These are explanations you're giving to kids. She's tired because she's dying from cancer. What's some kids going to conclude from that? What? I'm tired, therefore, right? You see where their little brains are going? Grandpa went to sleep. Well, how are you going to sleep for the next few nights? We don't think of these things. You see, these kids take the stuff literally. Child says, okay, this grandfather dies, and she comes up to mom. When are they going to chop off his head? Well, they're not going to chop off grandpa's head. He's dying. Whatever. She goes to her father. When are they going to chop off grandpa's head? I don't want to hear you talking about that anymore. You don't chop people's heads off. Finally, later, she goes to the kitchen with your grandma and says, Grandma, when are they going to chop, this is the other grandpa's, head off? Because he's dying now. She says, well, dear, what do you mean? At least acknowledges the kid, it doesn't dismiss it. Well, remember last year when your husband died and we went to the funeral, and you showed me his headstone. That's where his head is. the head is under the headstone. What do you think they call it a headstone for? Duh! See? It's not such a dumb question after all. Death is when the body stops working. This is what a teacher said in class, third grade class. We're talking about death. Who raises his hands? Well, what about Johnny? When are they going to bury his legs? He's paralyzed. They're not working anymore. So they should chop his legs off and bury it because they're not working. We lost your grandmother today. When are we going to go out and find her? I mean, this stuff is humorous, but it's not. To these kids, this is what they go on with. And if we don't talk to them and find anything else, this can go on for weeks, months, and trust me, years and decades. Your mother's body will be cremated. What's cremation, Mommy? Well, they burn it in an oven. Okay, now, that's true. Well, what's the kid thinking? So-and-so's already died, and now they're going to burn him? Burning is painful. And in an oven? So, I mean, end of story. What's this kid got for an idea of what's happening to that body? So, very important. Choose your words carefully. Heated until they turn into ashes. Oh, kid gets ashes, heated, but you're not using the burned, a very strong emotional word. Your aunt has gone on a long trip. Ever heard that? Yes. Your mommy has gone to heaven. Why did mommy choose to go to heaven and live instead of be here with me? Why would mommy want to go to heaven and leave me and my brothers and sisters and daddy? She's gone to heaven. End of statement. God wanted another angel and took Billy to be with him. Hear that very commonly, unfortunately. That's wrong on a lot of levels. You got a problem if a God is so hurt and he needs another little angel. I mean, at a higher level of process, but to the kid, that doesn't make very good sense. Your father was taken in his sleep. Yeah, he had a heart attack in his sleep. But use the verbiage, was taken in his sleep. Again, what does that convey? What's going on in the child's brain? And Judy Hunter gave me this one for her daughter. Her father died, and so her daughter asked her, why did Grandpa die? And Judy said, want to give her the honest answer? Your grandfather died because he drank too much. Okay, a day or two later, I can't remember exactly, when Judy's other friend's mom calls up and says, hey, your daughter's not drinking. She's not drinking. Because Grandpa died because he drank too much. Now he's an alcoholic, but he drank too much, which is true, but you see, so there's a real example that we have somebody that we know. Children also lack the words to express themselves. They often show mixed emotions, which can be very confusing to them. They feel anger, they feel loss, all these flood of emotions. They interpret us not saying anything, that we don't hurt anymore, or that speaking of the deceased is taboo. We shouldn't talk about the dead people. That's what we do when we don't say anything. They wait for us to initiate conversation, whereas we should be starting it. Are sometimes kept away from the body or the funeral in an effort to protect them emotionally. There are different ways you can do funerals with kids. Sometimes they want to go up and feel the body. But with all these other people around, and they want to go up and feel the kid, and feel grandpa or daddy. No. So sometimes you want to ask the funeral director, can they come and see daddy privately when there's nobody around, in touch, or you can explain to them. We often forget, or don't even realize also, I didn't think of this until I started doing this class, that their belief system, which is in the next lecture, big belief system, or worldviews. How many kids got a worldview? Yeah, they do, is shattered too. A child who experiences the death of a loved one loses his or her innocence forever, I would suggest. Think about it. You're innocent, nice little kid, and then all of a sudden, someone very important to you dies. What is your whole thing of the world? There's no guarantee. How could something like this happen? So whatever view you have, there's a belief system that kids have. And that innocence that we like to protect them from is gone forever. You don't get that back. So, how can we help children grieve? So what are some positive things we can do? Encourage the expression of feelings, just like adults. Convey that it's all right to show emotions. Let them know whatever their feelings are, it's okay. And everyone expresses their emotions, even similar emotions, in different ways. Avoid euphemisms, like we talked about, and untruths. Truthful explanations. They'll be misinterpreted, or else you have to retract them later, which leads to a lack of trust. Open the lines of communication. When you are prepared to tell your child about the death, find the right place that will allow the child to talk freely and without interruption. Don't text them. Or don't yell upstairs, your so-and-so died. Tell them they can always, but don't say always unless you really need it. Talk to you anytime they need to or want to. Answer questions truthfully. Their questions should be answered in words they can understand and as fully as appropriate. As children seek a beginning, a middle, and an end to a story. So if you leave out one of those, they will fill in the blanks. However, I think the key point I found very true. I teach this in sex therapy. Only answer what's being asked. Be sure you understand what is being asked and provide only the information he or she needs or wants at that time. So the kid asks you a question about sex or about death or something, it's specific, answer that question. You don't have to sit down and give them the whole birds and bees lecture. Oh, gee, the kid wants to learn everything about sex. No, they just saw some dogs doing it in the backyard and, they just want to know what's going on. And that's all. They don't want the whole shebang, they just want to know what those dogs doing. So if you have a little specific explanation for that, then they're okay. Important tip I found, very useful, is responding to the child by, well, what do you think? Example. This girl says, what will happen to my brother's body? So you're thinking, oh, she wants to know all about the body. Well, what do you think happens to the body? So she says, responds to your question by asking if he'll be able to play baseball in heaven. That's all she wants to know. Can her brother play baseball in heaven? Well, if you didn't ask her what's going on in her little brain, you're going to go into this big long explanation of cremation and burial. And she just wants to know if you can play baseball. Well, how would you ever get there unless you ask her? You see? So I found that catches a lot of, really cuts to the chase sometimes. Lastly, model your best practices that you're supposed to show. Help them find ways to ritualize and memorialize their loved one. Have them write a letter, draw a picture, return to a favorite fishing site, have some mementos of the deceased, plant a tree, etc. Remember that their emotions may be very erratic and unpredictable, just like adults, and their mourning is just as unique and individual as yours. How should you treat grief? Parents who've lost a child. While the sorrow of grief is normal and to be expected, studies indicate that clinical depression is likely to occur in only 30 to 35% of bereaved parents. The other 70% will not experience any type of depression that calls for prescribed medication. Doctors should avoid prescribing antidepressants and anti-anxiety agents for newly bereaved parents, at least for the first 2 to 3 months following the death of a child. After that, if the symptoms warrant it, a trial might be indicated, with the understanding that medication will not remove the grief. It only makes it more bearable. I like this guideline. If many people make it through with only information and validation, what's the next level of help or treatment? Specific suggestions. And I think we'll try to take just a 5-minute break because I've still got part to cover, so we can take 5 and then bring your coffee and stuff back, and then we'll continue on, move up our pyramid on more. So, thank you. About kids and adults, some specific suggestions. Guidelines to help through mourning. What are some of the tasks that need to be done? How do we help ourselves and others navigate through these stages? Being aware that they are not stages that must be followed in order, but only a framework to help us see where we're at emotionally. I think if you look at the stages that way, they're helpful. Identify when grief can or has gone awry, and what treatment would look like. Goals of care. Denial. Denial is protective for us. The body is in shock. It's a protective mechanism. It just doesn't want to deal with anything else. And that's okay. You eventually get through that. Anger, express it. Pain, sadness, and fears. And in men, we recall, anger is often the flip side of depression. So I had a woman in the office yesterday who was talking about some arthritis in her hand, and she, on the side, says, "Well, my husband's very mad. And he's always angry." And I got into it a little bit, and well, he had open heart surgery a couple of years ago, major heart surgery and stuff, and he says, "Can you talk to him about it?" He says, "No, we won't talk about it, about that." I said, "Well, it's a good chance that he has major depression, but men don't manifest it, and he's angry, but he's really depressed." Depression, allow it, validate it. We'll have to find out how much, when is it too much, and acceptance. Helping find a good bye and learn to live with the one you lost. These, I think, if you want to summarize it, are the 3 steps of healing. If you want to just take home points why it started there. Feel your feelings. Secondly, allow old wounds to come up for healing. And we're going to specifically talk about that because I think that's very important. These are negative thoughts that stretch beyond the current loss. So you just think, and we think, we're just dealing with this loss here. No, I'm telling you, psychologically, there's very often baggage that's coming up with that. 3, changing distorted thinking about relationships, love, and life. What's our belief, the bigger system? So these are the steps if we really want to completely heal. Rituals are symbolic acts that help us concretely or physically express our sadness, meaning, belief, values, and love. I spent an hour and a half talking to Rabbi Rob last Saturday at the coffee shop. It was great, because I'm so impressed by the Jewish tradition. They've got this thing down. You take care of the body. Someone watches the body. The body's never alone. You do 7 days of Shiva. You have other people come in. The community does this. You have a month of this. You have 11 months of Kaddish. You have your atonement memorial things every year. It's all thought out really well. Tremendous ritual. That's got to be a tremendous help in people getting over grief. Things like going dirt on the casket, flag if you serve in the military. We have other rituals, but I think the richer they are, the more helpful. What are pitfalls in getting over loss? Putting it on the timetable. Oh, you should be over this. I should be over this by this time. When you're going through a rough patch, thinking it's over. So a couple months later, I'm just doing great. No, don't be cocky, because a few days later, you may be down in the doldrums again, or doldrums. Hang on to the pain as a connection. Grief can be an attachment in itself. We'll see about that. Feeling guilty about laughing and living again. All of a sudden, you're having some happiness or feeling good, but then you feel guilty about, oh, I shouldn't be feeling like that because I'm supposed to be grieving. No, that's a sign that you're starting to heal. He had bottled up his feelings over many years. Whoa. Big issue with bottling things up is it doesn't go away. And that it can just all explode. Roles to avoid. I'm fine. We already talked about this before, the Academy Award role. I'm doing okay. Yeah, how are you doing? I'm fine. The derelict role. Sometimes I see this. Failing to do daily tasks. Guy loses his wife, doesn't get up, doesn't shave, stay, watch TV, doesn't go out. Literally starts looking like a derelict. That's a role. They just can't do anything. People getting up, eating breakfast, getting your makeup on, women, guys shaving. I mean, doing these basic things helps grieving, just doing these basic functions that you do. The sick role, realizing that you may get more attention of others if you remain ill. I see this in other people too. And upping the ante if needed. Usually it's subconscious. So I'm not getting attention. Well, I'll make myself more sad. It's not a conscious, sneaky thing. Some people it is getting drugs and different things, but for this it's not. Oh, gee, cartoon. Acting sad will make your friends pay attention to you. Sometimes that's true, right? If you go on and just, why are they going to call you? You're just doing fine. You know, if you're acting fine, you don't need any help, support, other stuff, right? So if you act kind of bad, then, you see how the psychology of that works? Roles to avoid continued. Be strong role. Some examples. I love this, and I want to read from Kubler-Ross. What can give you 3 examples of be strong, because I think you'll see the points. A senior in high school was playing on the school football team when his mother died. The very next day, the rival school was coming to play them in the big game, and the teenager was shattered. His coach said, "Play for your mom. Be strong. Be brave. Go win it for her." That sounded like a great movie plot, but the team was on a losing streak and they lost that day too. Years later, the young man talked about how violated he had felt. He said, "The last place I wanted to be was on the football field, but I didn't know what else to do." In this case, there were no points for not grieving and none for being brave. Jennifer was told to be strong for her children when her husband died. Today she wonders about the message her dry eyes implied. Did her children think she didn't care? What if I did cry in front of the kids? What if I modeled grief for them in that way? I could have said, "Mommy is sad and crying because Daddy has died." I could have reassured them that I was still strong enough to be there for them and take care of them. Children need to know that strong people cry when loved ones die, and that does not hamper their ability to go on with life. Jennifer feels she missed an opportunity to share her loss instead of demonstrating a facade of false strength. Strength and grief can show up in other ways. Wanda, grieving the loss of her twin brother Dwayne to cancer, was devastated by his absence. A month into her loss, her friend Gail came by to visit her and was horrified to see Wanda in her pajamas, still sobbing uncontrollably. "You have to be strong," Gail told her distraught friend. "It's Saturday. Let's go shopping. You need to get back out there. It's been a whole month. You can't work all week and cry all weekend." What kind of life is that? Wanda looked at her friend and through her tears and asked, quote, "What's so strong about going to the mall, Gail? The real question is, do you have the strength to sit here with me in my sorrow?" Wanda had the strength to say what others had only wished they'd said. All too often, someone chooses shopping or fishing to placate a friend or to avoid their own pain. Most of us would just about do anything rather than sit with someone in grief. But grief must be fully experienced to provide healing on the other side. The only way out is through it. So you can put it off, but you can't skip it. You hear, be strong. Think about it. The keep busy role, we already talked about that. Get in there, keep busy. The despairing role. Sometimes I see people who become cynical, withdrawn, they have their dark glasses on after a traumatic loss. Not just the people, maybe they went financially bust or whatever. Sometimes even developing paranoid tendencies. The whole work, they see everything, they become a negative person, right? Because of the loss. You know what those people are like. The I can do it alone role. Grieves in silence, alone, and refuses the help and companionship of others. Let's go out and do, let me help you, let me just do this. Nope, I can do that. Often the macho male role, right? We can hunker down, we can handle this. Grieving is a natural process that should not be tampered with. Sigmund Freud, 1917, Mourning and Melancholia. Agree with Freud? I disagree with Freud. Some grief, mainly unresolved grief, should be treated. Why? Bereavement, while a normal part of life, causes a degree of risk when severe. Severe reactions affect about 10 to 15% of people. They can occur with people with depression, who've had depression before the loss. They can carry into family relations. They found marital breakup following the death of a child. How many of you have known or experienced that? A young child dies or in the marriage goes. 5 times greater risk of suicide in teens following the death of a parent. 5 times. So you have one loss in the family, and then you have another loss. That's just statistics. Unresolved mourning and grief not only causes prolonged unhappiness, which would be a reason to treat it, but also leads to more serious medical problems. 1944, a study showed mourners were higher risk for MI, cancer, hypertension, diabetes, rheumatoid arthritis, and skin and thyroid disorders. Dr. James Lynch found that mourners run a 2 to 2.5 times the risk for a heart attack. That's significant. Mourners were found to have a 3 to 3.5 times the risk of non-mourners for gastrointestinal cancers. So people mourning, later they develop cancer. That's significant statistics. The mortality of men who lose their spouses is much higher than women who lose their husbands. We could talk about that for a while. That's well documented and recorded. We're all familiar with the case, particularly of the elderly people who have really lived a long time with each other. One dies, and then pretty soon the other dies. That was their whole life, their whole... Who dies? How much of what we call grief is the experience of a previous loss? And how do we allow such grief to be a motivator for our life? Complicated grief. Grief that has been complicated by other factors, age, circumstances, if it's a crime, ambivalent relationship toward your person that is lost, disasters, multiple losses, suicide, unresolved issues, personality, socially unacceptable, minimizing loss, absence of community. Complicated grief, they're stuck somewhere in this grief process. What are some clues? These could be clues. It's a fresh grief, but it's an old loss. Minor events can trigger it. Possessions intact. You go to somebody's house and the deceased room has not been changed one thing for 3 months, 4 months, 6 months. That could be a clue. Decreased physical symptoms. They're not showing signs of fatigue or decreased energy or crying. They just are acting normal. Red flag might go up. Excluding family and friends. Withdrawing. Guilt or lower self-esteem. Self-destructive impulses. Uncomfortable sadness. Phobias about illness or death, particularly in children. Something dies of something, they often take on that phobia of whatever had killed the person. And the circumstances around the death are hard to discuss or avoid. We talked about that. Another unfortunate disease that I believe is way underdiagnosed is substance abuse, especially alcoholism. I would suggest that self-medication for the pain of unresolved grief from any source is a major contributing factor, and that unless this is addressed and treated, that relapse is highly likely. That's just my theory, but I think it has a lot of credence. Why people relapse. They don't deal with the grief of what the people are self-medicating for. Moving up the pyramid. Okay, we've learned this. What about specific exercises? What are things to do that I do? In sex therapy, there's specific exercises of homework, which people like to usually do that. And here there's certain exercises that we're going to talk about reading and writing and doing things. What exercises of work needs to be done? In my treatment experience, patients cannot or rarely are able to help themselves out of a dysfunctional state. So people, just give it time. I'm going to do it. There's a point that this grief is pathologic that they're not going to get over it themselves. They need some help. They need some direction. They usually require the help of a professional, be a psychologist, doctor, minister. What did I tell you earlier? How well are we prepared to deal with this? As doctors, not very well. Psychologists, yes, some. Ministers, how much training did you have in your pastoral for grief training? A lot? A little. We're surprised to find that our ministers have less. So people are not trained. However, I also think that many professionals are either not trained well in grief management or else used the one model treats all that they were taught in training. I know I'm a little cynical about that, but I feel that. So just because you're going to somebody to help with this isn't necessarily that you're going to do well. Hawkins sent me that article in the New York Times about this child, a woman who lost her child, went to this grief counselor, and that one, and finally came to the third one, and the third one said, "You're okay, you lost this child. We're not going to try to fix it, you just have to get through it." That's all they needed. But these other counselors wanted to fix them. As I hope I convinced you in the class on emotional well-being, only a holistic approach has the ability to fully heal. That means biochemical, psychological, sociological, and spiritual. Geez, you were feeling bad already. It's your bill. John James and Frank Cherry have laid out a process that I found extremely successful over the years in the treatment of unresolved grief. The process allows one to help complete a relationship with someone who has already died. So, the solution that they have is it requires 5 things, 5 steps to do. Gaining awareness that an incomplete relationship exists. 2, accept responsibility that in part, you're part of the cause of this existence. 3, identify recovery communications that you have not delivered. 4, take actions to communicate it. It's just not about thinking about it. 5, move beyond loss through sharing with others. Gaining awareness. The first step is become aware that there are losses that you are still emotionally incomplete with. When you are reminded of a loss from the past, if your first response is one of pain or discomfort in thinking about it, you are emotionally incomplete with that loss. It doesn't have to be of a person. If you try to avoid thinking or remembering it, get angry if someone says you're avoiding it, or you tend to minimize it, you're probably incomplete with it. If tears come to your eyes when thinking or talking about it, you are emotionally incomplete about that event or loss. The tool that I had you do for homework. There was a method in that madness. This is one of the authors. And by doing this, you find out what are the painful things. You notice grandfather dying, moving was a big loss. Breakup, Vietnam, dad, brother, son, divorce. You can't say, well, father's more important than that. It all depends on you and your experience. The reason you did this is to identify significant losses in your life. Now you can decide which ones are emotionally incomplete. When I went back and did mine, I found about 3 major losses that I feel comfortable sharing with you. One is my father. I told you I had a complete with my mother. I think about her death and here and whatever. But I told you my father died when I was in graduate school. And it had the typical father-son male relationship. We didn't talk to your dad about feelings. And he died. I didn't have a chance to say goodbye. And I didn't cry at the funeral. I never shed tears. But I avoided. I don't even know what day he died on. Why not? Because my intellectual part of me says, well, why would I want to remember something bad? That's kind of stupid. So I don't even know what day he died on. So I don't have to go through an anniversary when my dad died 2 years ago or 5 years ago, because I just don't remember when he died. I've not told my kids much about their grandfather. Because what am I role modeling? Well, we don't talk about dad because that's uncompleted. We had a dissolution at Grinnell Family Care many years ago with Dr. Ferguson. That's a loss that in going over this that I'm not, it still brings up feelings. So, it's lost. And I discovered that after I did my line graph. Came back to me a few days ago when I was in the office talking to somebody else. I've had one malpractice suit in my career. Hopefully that's all I'll have. But I'm thinking about that. I've not resolved that. Why? I get extremely angry, upset, and whatever, even though that happened a long time ago, and we went settle out of court, and I just, well, that's one of these. So I got some work to do. So what do I do about it? When death occurs, we're often caught wishing things were different, better, or more. What we did or did not do in our relationship with this person. What we did or did not say to that person. We're often too critical of ourselves, which often leads to feelings of guilt. Different, better, more. What did the other person do or didn't do that hurt us? What did the other person say or didn't say that we want them to say or wanted them to say? We're often over-complimentary or inaccurate in our praise of the other person. Oh, he was such a good husband, he was such a good child. We tend to over-compliment him and tend to put ourselves down. But we may have feelings of resentment or even hatred toward that person. But that was your father, that was your mother, that was your uncle. And then feel guilty over feeling that way. Because you're not supposed to feel that way about your father, mother, whatever. This is especially true with the death of a child or baby. What are all the dreams that we had for them? What are all the experiences of life they'll never have? What are all the things we wanted to share and give them that we never had growing up? What are the loss of all their dreams and hopes if it was an older child? The parents experience all these losses with a child who was miscarried or stillborn, a fact that's often minimized to the detriment of the parents. We don't think of them as a real person, so you can see where that is pathologic. The father's grief is often not acknowledged by others, and he's left to grieve in silence. About the mother, the miscarriage, where it's all about her. What about the dad? He often gets left out. What are the feelings of the loss surrounding adoption? Trust me, there are some on all parties involved. Sure, we get those out and deal with them. Once we've identified our losses, we need to share them with another human being. Others provide a wonderful sounding board and can often see when we are either deceiving ourselves or else minimizing our feelings. That's why I suggested that if you haven't or sometimes, share it with somebody else. If you explain that to them, they can look at your body language and see if you're BSing them or not. They say, are you sure that doesn't bother you as you're crying? No, that doesn't bother me at all. I'm okay with that. Yeah, well, I don't know if I buy in that. Right? So, sharing it with someone else is helpful. 2, accept responsibility for our feelings, for our role in what we did or didn't do in the relationship. Admit that we often wish to be right rather than have done what was best for the relationship. That's a crap that a lot of us fall into. Remember what things we never said because the time wasn't right or we worried about how they would react. We really are responsible for our feelings. Some of you in here don't like to hear this. But if grief just takes time is the biggest fallacy in dealing with loss, I think you all agree with that, right? Just takes time. Then the next most common incorrect belief is that other people or events are responsible for their feelings. What are we taught as children? So you're a little kid at home. You make me so proud. You make me feel angry. You make me this. You make me that. So the kid's realizing, gee, how they feel is dependent on how I act. So the kid comes home from school later, Johnny makes me feel this way, Johnny makes me feel that way. Well, no, your reaction to Johnny is what the problem is, but you see, so we learn this from right out of the crib. Example, on the way to work in a car store. Okay, just give an example. Going to work, big city, probably not Grinnell, Iowa, come to a stop sign and the light's red. So you're there and pretty soon, and you look up, oh, light's green. So, what do? You roll down your window and say, hey bud, thanks for reminding me that the light's green. Don't you? No. You go, oh, all right. Or you slip from the bird, or you do something. Or you go and you go, and you just go slow on purpose. Right? Which one of these do we usually do? He makes me, oh, wait a minute. Whose idiot problem was this? Is it his fault feelings? We're the one that wasn't there for the light. But we can't accept responsibility, right? It's easier to blame somebody else for the way we feel. Then we have a little choice in that. When we make other people responsible for our feelings, this is key point, we also make them responsible for ending our feelings. So you can't have it both ways. You can't say, well, okay, people are responsible for our feelings. And that's going to be a problem. When we make loss totally responsible for our pain, we make replacement of the loss our only hope for ending the pain. If you buy into the first part, you're stuck in the second one. And then you wonder why you're not going to get better. Which often leads to assuming the victim role. We become reactive rather than proactive, in Stephen Covey's terms, which then leads to the paralysis of action and feeling of helplessness and hopelessness. I can't do this, I don't have any, they make me feel this loss made me this. 3, identify recovery communications, make amends. That means things that we're sorry for. Either having said, done, or not having said or done. Offering forgiveness. Things we need to forgive others for, either real or imagined. 3, expressing significant emotional statements that we need or want to say. I love you, I was part of you, thank you, etc. So to do this, the next specific exercise I have people do, and I didn't have you do this, but if you need to do this, I need to do this, about a person, not an event. You make the same graph. These are negative things. These are positive things about the person. So you put stuff above the line. Because the relationship with somebody wasn't all negative, was it? Amends above the line, happy, positive. 2, forgiveness, stuff happens below the lines, unhappy, negative, significant emotional statements, other undelivered communications. Some other things about forgiveness. Some people get stuck with this forgive. To forgive is not to condone. Read that again. To forgive is not to condone. Forgiving people does not mean endorsing their actions. If you grew up in an abusive home, the abuser was emotionally ill. If you grew up in an alcoholic home, the alcoholic had a disease. If you were molested, the molester was ill. Forgive the ill part of the person. Once you separate the illness from the person, it's easier to forgive and let the resentment, hate, and anger go. I said I was going to talk about unbroken. And it says survival, resilience, redemption. They didn't talk about redemption in the movie. They cut it off too early. He didn't have any redemption. So my take on that is the movie ended after he got out of the prison camp and came home. Everything looks good. Now he has post-traumatic stress disorder, which all men have to go to war. He doesn't know how to deal with that. He starts drinking. His marriage goes to heck. He is going down the proverbial tubes. Finally goes into Billy Graham, a revival he's having out in California. Picks up a little bit. For him, the light went on. I have to forgive these guys that tortured me. I have to get rid of this anger and go find that guy, the bird that tortured me all these times. Because his natural instinct is what? I'm going to find that guy and I'm going to kill him. Right? Or I'm going to hire somebody as a hitman. I'm going to get that guy. I'm going to kill him. I'm going to kill him. Anger, resentment. Now, he goes through this. I'm going to forgive. And he does go to Japan. And he does find these people that took care of the camp that he was in and personally met them. And forgave them. See the difference? Choice. So to me, yeah, taking all the physical pain and torture, yeah, that was great and that was super, and well, it wasn't if you felt like pain and torture or whatever, but when he went home, the mental anguish, far worse than the physical. The guy stops beating you for a while, you go back in. But your mind, can you ever escape your mind? No. That is far more demons to deal with these mental issues than the physical. And that could have been a great thing in the movie, but obviously it was not. So read the book. Taking action. At this point, I have the person sit down and write, underline write, a farewell letter to the deceased. I request that the letter be shared and read to another human being. Remember, you can't completely grieve alone. That the letter be read out loud to the deceased at a symbolic place and or time. And that the letter be kept, burned, buried at the grave, released into the sky with a balloon, saved or deleted on the computer, or whatever seems appropriate. This is done with the imaginary scenario that the deceased, wherever they may be, I don't know where they be, it makes no difference. That they can hear you for the time it takes you to read your letter. There will be no more communications with them after this. So you got the shot, you can talk to them one more time for this amount of time. After the person debriefs with me in the office, they go through this exercise. I sometimes have them write a short note on what they imagine the loved one would have said back to them after hearing their letter. This is hypothetical, however, and I tell them that because we know they're dead and they'll never be able to respond. But what would your loved one say to you on getting that letter? I found this last exercise often very powerful in revealing as well as being extremely therapeutic. It's just amazing the things. Well, I think they would have said this in response to it. We don't know. This act of saying a final goodbye allows the emotional relationship to be completed. This exercise, which takes strength and great courage, it's not an easy exercise to do. Can be completed for any and all incomplete losses in relationships. So I'm going to have to do that for my father. And just thinking about it, I start to get a little teary because I've got buckets of tears that have never come out. And they have to come out. And so when I do this, it's going to be emotional. How I deal with this malpractice thing, and I got some other ideas on dealing with those things, but again, so ideally you want to complete these losses. Me too. The last thing is intensive psychotherapy. So we've taken you through these exercises, specific suggestions. An example is post-traumatic stress disorder. This is tough. There's a lot of more things that go on up there. So I had a college student last week who had been sexually abused last semester. And he's working through that. And it's affecting his academics. It's just, you don't just give him a pill, you don't give him some information. It requires some heavier duty type stuff. So we're working on that. What about our veterans? As we saw in this slide before, post-traumatic event. Doesn't tell you what it is. 1 year, 2 years. Some people that are very resilient do well. They come back from war, they're just fine. They get a big bump here, but then they're okay. Some other people have a delayed reaction. They're okay, and then all of a sudden they decompensate. And I have to see American Sniper to get some more insight into that. And some people, path is this way. Horrible at first, but then gradually over time, with ups and downs, of course. And some people, these are the people that really need help. Because remember, 3 times as many people in Vietnam killed themselves than were killed in Vietnam. So these are the people that are up here chronic, that we don't take care of, we don't deal with. Well, it's not going to be a good outcome. Let alone house their own suffering and their families and everything else. So it's tremendous emotional cost here. This is what we did when people came back from World War II. Remember my class on depression? What are they doing? Prefrontal lobotomies. Remember, we did thousands of those and thousands of those on our men that came back with post-traumatic stress disorder. Put those knitting needles up through the eyeballs and in the brain and wiggle them all over until you destroy the frontal cortex.
And after World War I, nothing.
After World War I was nothing. The question is, after World War I, nothing. We didn't even do anything. They're trying to do something here, but I mean, is the treatment worse than the disease in this case? So we're a little better on that, but I still say we have a long way to go. Moving beyond loss. We'll discuss this in conjunction with stage 6, the potential for growth. You go, whoa, where's it going with that? Well, that's one of the things that's to be continued. So how do we move beyond this into, yeah, we got this bad experience, and we resolve it and we do okay with it, but how do we even make it better? That sounds like an oxymoron, but you can't. We've talked about grief in the past, but now let's talk about grief in the future. Then later, again, at some future time, we can talk about loss in the present. How do you see loss? How you see events and how you frame it in your belief system makes a difference on which way you go with it. But I don't have time to get into that today. So the last topic I want to make sure we get into is anticipatory grief. Which is worse, to have a loved one die suddenly or over a given time period? What do you think? Huh? Is it better if you just, bam, you die or get hit in a car thing? What's better for you? Never thought about it. Well, think about it. Which way would you rather go? What about the surviving people, which is better for them? All of a sudden, you're dead? Or you have a cancer or a slow thing, you have time for anticipatory grief. You can think about that. Those are open questions. Some diseases like ALS, MS, Alzheimer's, emphysema, and some cancers may go slowly. Anticipating a loss is an important part of experience as the loss. So sometimes anticipatory that you're going to have this big calculus exam is just as painful as when you have the calculus exam. If you have a calculus exam, seriously. You can have a tremendous emotional angst before you have the test. And then you have it again when you get the test. And it's as bad as you thought. It's generally more silent than grief after a loss. When people are dying, we're not as emotional about it. It's a grief we keep to ourselves, usually. When a loved one has to undergo anticipatory grief in order to prepare for their final separation from this world, we have to go through it too. So your loved one is dying, you're going through that process too, aren't you? You know what's coming up. How are you going through grief? Even if you go through the 5 stages before the death, you still have to go through them again after the loss. You still have to take your calculus exam. Not everyone experiences anticipatory grief. Not everybody. Remember, nobody follows these rules. And if they do, certainly not in the same way. So all of us can experience that differently. However, there are some positives to anticipatory grief. In hospice, we are grateful for this time. It's often during this time that we help bring about healing and growth, even in the face of death. It's a lot of emotional building, saying goodbyes, doing all the things we talked about in the letter. In the letter, the person's already gone. In hospice, we encourage people to do those things while they're still living in front of us. The things I wish that you got time to do that now. So we try to facilitate that can happen. And to the dying person, say the things that they want, because if you die suddenly in a car crash, you can't tell your spouse or significant other or your kids how much you love them because maybe you didn't, or your chance is gone. But if people are dying in hospice, they have a chance to do this. What about grief? Sometimes grief support groups are good. It's a myth, however, to think that just because you've lost a baby that you can only get help from somebody that's lost babies. Or you've had this. Yes, I'm saying it's more likely that there's more difference within a grief group for a certain loss than there is for, than the variety is among different groups. So therefore, you don't, if you want to go to bereavement just for spouses, well, that's nice, but any bereavement, it's the same process. You see what I'm saying? Yes, other people are going through the same situation, but no, it isn't the same. Everybody's is unique. They have unique relationships with their loved ones. Had to put this in. We have a hospice support group that meets, and our regional hospice offering grief support for adults experiencing the loss of a loved one or friend. And unfortunately, it conflicts a little bit with some of the bucket classes, but this is when they are. It's at the Drake Library. It's down there. That's why some of the people were not here. And Beth Gallegos at the hospital, numbers 2418. If people think that would be useful. Okay, I'm winding down now. Remember, I said I was going to talk about Mr. Emmanuel, and he hopes he dies at 75. I think we talked about that. My rebuttal is that he doesn't seem to know how to really deal with loss and grief. He's talking about all these things that's going to happen, and he's just going to go, I think he needs a little help with this. Plus, he's also, 57, 58 now. So we'll see if he changes his tune when he gets to 75. So that's my first caveat. Yeah. We'll see what he thinks. But he's obviously not familiar with this data, the happiness curve. Analysis by these scholars on Gallup poll shows a clear relationship between age and well-being in the United States. Respondents rated their life satisfaction relative to the best possible life for them, with 0 being the worst and 10 the best. So here's 6, 7, 8. So here's the curve. Gee, it kind of goes down, 50, 55, then it goes up. Look where 75-year-old people are. Oh, so he wants to check off. Okay, well, that's fine, but for most people, and part of the next class, if we have one, is to be, well, how do you deal with all these losses and things? Because it's the way you deal with these losses that determines. But for general, people still, you guys are a pretty happy camper group here, right? And we're not cutting all the 75 years off at the knees. Nevertheless, we can and should plan for our death for a number of good reasons. You plan for a birthday, you plan for a trip, No, why don't you plan for your death? So, you get a will. You get your house, your dog, your cats. You have your durable power of attorney. You have a living will. What do you want your doctors to do or not do? Sally Johnson, we're competing with her memorial service now. She had it. When she had her bad stroke, she honored what Sally wanted. Very clear. She didn't have that. Kids come from Tennessee and Florida and, well, we want to do this or don't do that. It can be sticky wicket. So we did what Sally wanted. An ethical will. That's a new term that we have. Where you write, we try to work this in hospice, your legacy. What do you want your kids, your next generation, what have you learned from life? So we call that an ethical will. You write this down and say, these are the things I've learned, these are the things I value, these are the things I important. And you can give them in a written form. One man who I read about in one of my grief books, he had a horrible experience with when he was a kid and a family member died. They didn't talk to him when he did this. So he made a videotape. He was dying of cancer. Videotape to be seen by his daughter when she graduates from high school. She's not to see that. Another video when she is about to get married. Another video when she's going to have kids. And another video that is just if she's lonely and wants to talk to dad. So dad makes all these little different videos. So before the parents, he's going to say about, boy, what raising kids is not a picnic. And giving her advice. And she can see her dad there. He can't be there in life to give her that advice, but she can play that. Isn't that neat? I thought, yeah. That's what we call an ethical will. Pretty good legacy. In conclusion, I have just 3 closing thoughts. Fortune cookie wisdom. If you don't remember anything out of this class, fortune cookie. Pleasant experiences make life delightful. Painful experiences lead to growth. I think that's pithy and right on. When I die, bury me with a flashlight and a good book. That's for dummies. That's going to be my next book. I think there's a need for that. I think it would save very well. Those of you that have your headlamps, put that in your casket like this. That's the second big point.
That's for dummies.
Just when modern Western society is preaching winning at all costs, we've seen that, all costs, I'll repeat that, accumulating, owning, securing, and living as long as possible. Aboriginal wisdom still rings true to me. We are all visitors to this time, this place. We're just passing through. Our purpose here is to observe, to learn, to grow, to love, and then we return home. So that is the saying I would like to leave you with, and you've been a wonderful class, and we will conclude at this point.
Here comes trouble. I'm not sure I can handle this grief. You're done. I'm shedding tears.
That's okay.
But if you promise to come back, that will help me get over this. Will you do that?
Yes.
Oh, good grief. When grief is something I must bear, I'm tempted to just let despair control the way I face each day. My life to fall in disarray. I'm told, oh, you'll get used to it. You'll feel just fine in a little bit. Or he's in a better place. So I put on a happy face and act like I'm just doing great, just hoping that with a short wait, I'll recover from my loss and be forever happy and grief-free. But this isn't the way it goes. It doesn't just come to a close. There's so much that remains behind forever, etched into my mind. But now I know there are more ways to handle grief in coming days than I would ever have believed. Ways that let me to believe that I can handle my own loss in my own way. I am the boss of what I make of my new life with just the minimum of strife. Thank you, JR, for showing us we don't just have to bawl and cuss or pull our hair and weep and wail, because that's all to no avail. There are some ways to help us learn to face our lives at each bad turn. You've given us the help we need to face the sad things we must heed, so we can live fulfilling lives without the fear of getting hives.
Oh, hey, this is,
That's Lucy.
that's Lucy and her psychiatric help, except Lucy's
Yes.
picture's out of there. Psychiatric help,
You.
$5, and it's me there.
We got you. We have your nickel. We
And
have
the
our
doctor
nickel.
is in. Oh, my nickel. So that's my pay for these four concerts. That's a pretty good deal. No, I'm just in it. Thank you all very much. All right. Thank you. Very much, man. Comes up with me, very good.
Thank you, Nisha. You're awesome, as is JR. Well, it sounds like we're going to have JR back again sometime to finish his coursework for us, and I think you all agreed to have us work that in. And next week is our open Wednesday, and the volunteers from the Grinnell Historical Museum will be here to talk about the outstanding women in the history of Grinnell, the trailblazers. So enjoy the rest of this beautiful afternoon, and we'll see you next week. Thank you for coming.